Do you realize that once you lose your teeth, you will continually lose bone for the rest of your life? If you wear dentures, chances are that when you first got them, they fit pretty well. The way they fit onto your gums was probably fairly snug. However, if you've had those dentures for a while, chances are they don't fit the way they did when they were brand new. There's a reason why this happens. It's called bone reabsorption, which is just a fancy dentist term for bone loss. Normally, we think of bone as something that is solid, that doesn't change unless it breaks. Actually, our bones are very responsive. Essentially, bones can remodel depending on the forces that are applied to them. This is why astronauts have to exercise when they are in space. Without the force of gravity, their bones become thinner and weaker. Exercise prevents this. In order to understand what happens to your bones after you've lost a tooth, you first need to understand how the jawbone works. The upper and lower bones of your jaw actually have two layers, the basal bone and the alveolar bone. The basal bone is the regular part of your skeleton. When a person loses a tooth, the lack of stimulation to the alveolar bone that had been surrounding the tooth causes the bone to begin shrinking, just like the bones of astronauts begin shrinking if they're not getting stimulation from exercise. The shrinking process begins as soon as a tooth is lost or removed and will continue for the rest of your life if left untreated. But it's not just the bone that's affected, it's the gum tissue too. As the bones in a person's jaw lose width and height, the attached gum tissue gradually becomes thinner. Therefore, a person may have sore spots and feel more discomfort under his or her dentures. If a person has lost many teeth, their tongue often enlarges to fill the now empty space. At the same time, people start using their tongue to keep their dentures from moving. Their tongue may take a more active role in the chewing process, and this leads to the dentures feeling less stable. As long as there are teeth missing, the shrinkage of the jawbone is a lifelong, irreversible problem. Dental implants can provide the stimulation that the bone needs, so you can immediately stop the bone loss.